Katie Sanderson is a junior doctor working in London, and she speaks on behalf of Doctors UK and is taking time to join us this afternoon. We appreciate that, Katie Sanderson. And I wonder if you could describe the conditions for you at the moment. Do you feel as if you are on the edge, approaching crisis point?
I think some London hospitals are doing better than others, but in all hospitals, the rate of admission is far, far, far higher than the rate at which we're able to discharge patients. And everybody knows that that is unsustainable. I think it's become unsustainable already in some hospitals, and care is being compromised, and other hospitals are doing better, and that depends on the local population and how well resourced they are. But I think as doctors and nurses and healthcare workers, we're in this strange position of almost complete powerlessness. We're at the end of the road, and all we can do is treat people who are infected, who become seriously ill, as best we can. We can potentially do some extra shifts, and bosses and senior staff can do everything they can to increase capacity, to provide mutual aid and to look after people as well as possible. But we are not the people who have the power to make this better over the next few weeks. The people who have the power to make this better over the next few weeks is every single member of the public. And I think what we should all be thinking today is why would somebody this afternoon, this evening, tomorrow behave or need to behave in a way where they got coronavirus? And some people who are frontline workers are in a difficult position where it's difficult to avoid, but I think we could be doing more, and we've had often quite confusing and complex regulations. I think we need really clear communication. I think we need to understand why there are so many more people in schools than there were in the first wave, which is something that's been highlighted a lot today. I think everybody needs to combat false information that this is flu, this is nothing like the flu, that this is like a normal winter in the NHS. This is absolutely nothing like a normal winter in the NHS, and everybody has a duty to combat that kind of information. And then the other thing that we're seeing is that we are not proactively supporting people who need to isolate enough. I speak to people every day who have relatives in hospital with coronavirus to make sure that they understand that they need to isolate. And some people are in such precarious financial situations that they say, I'm not able to pay my rent, feed my children, and I don't think we're being proactive enough about making sure that people in that position can isolate.
You really want to reinforce that message, don't you? Which we think has been out there enough, but you're saying we need to ram it home.
We really need to ram it home, and people have choices, but some people don't have very many choices. And we had a sort of housing policy in the first wave of coronavirus, of sort of everybody in. We tried to get people off the streets, make sure that people had accommodation. That's another really important part of this policy. And I think sometimes we're very focused on ITU capacity. That is absolutely the end of the road. And that is, most of us we can't influence that, but we can all influence things that are further sort of upstream,
contributing factors
doing enough,
like homelessness. We're going to be talking a bit more about that later on in the programme. Can I just ask you, though, whether you have the equipment that you need to do what you need to do for your job? You've got so many more people being brought in. We've heard that firefighters are having to help with driving ambulances. They are brought into you. Have you got enough PPE, for instance?
So I think that's a really interesting question. People working in healthcare, but also other frontline workers, people collecting rubbish, bus drivers, everybody who has no choice but to go out and go to work, I think feels concerned about their safety. I don't think are doing enough to alleviate those fears, and the reasons why are I don't think we are vaccinating frontline workers fast enough, but also we've been calling all year for Public Health England to re-examine the guidance about PPE. Most healthcare workers and people working in nursing homes are looking after patients coughing with coronavirus early on in their illness, who are extremely infectious, in a fluid-resistant surgical mask, an apron, gloves and some kind of eye protection. We know those masks offer some protection, but they do not offer a high level of protection, and we know that staff in intensive care and doing aerosol generating procedures who have FFP3 masks have lower levels of illness and mortality. And I think we are protecting people with the absolute bare minimum, and we should be doing better, and people are not as safe as they could be.